Hi, I'm Dolly Vast, and welcome back to Dolly's World. I called our program today the Doctor's Dilemma. Actually, probably should have been called the Doctor's Crisis, because that's exactly what it is. And if their problem is not solved within the next couple of years, then we, John Q. Public, and that's you and me, are definitely going to suffer. So before we go any further, I'd like to introduce my two guests. Now, they have credits and resumes unbelievable. And if I took all that time to run them through, gentlemen, why, our whole half hour would be gone. So I'm simply going to introduce you. And to my far right is Dr. Edward Vonderschmidt III. He's from Princeton. He's a neurosurgeon. He's also president of the New Jersey Neurosurgical Society and legislative delegate to New Jersey Medical Society. And to his left is Dr. Ronald Bachner. He's an obstetrician, gynecologist, and founder of the New Jersey Citizens United for Health Care Access. Okay, welcome, gentlemen, and thank you so much for giving your time this morning. I know how busy you are and that you have to scoot out of here, and I have dozens of questions for you. So let's get started. What exactly is this medical crisis, and why is the malpractice so detrimental to your practices? And Ed, I'm going to start with you.
Good morning, Dolly, and thank you for having me here, and thank you for having us. More than a medical crisis, it's a liability crisis. As president of New Jersey Neurosurgery Society and also representative to the national organizations, National Neurosurgery sees New Jersey as a crisis state. So it's not defined by just those of us in the state, but by others. What defines the crisis is the difficulty in getting medical malpractice insurance and affordable insurance, even for people who have clean and good records and serve the community well. As you know, neurosurgery is a difficult and tedious field. All of the things that we do in it are critical and are many times life-saving procedures or life-saving care. So the crisis is one in which we have seen in the state, as a recent survey conducted by myself on behalf of our members, that over the last 3 years we have seen insurances go up on the order of 30 to 35% each year for the past 3 years. We've had a recent group that serves Central Jersey very well, that their insurance, they were not even able to get insurance as of January. They had to get into a new insurance company, and by the time they paid all the appropriate fees, the amount of their malpractice from last year to this year increased 100%. If you look at even hospitals who have to provide coverage for people in the state of New Jersey, and these are doctors and nurses who work in the hospitals that serve all of the community members by being there to help take care of them, that even their insurances in the last 3 years have gone up 100%. So it's a crisis that's defined by difficulty getting insurance and a great increase in the rates of insurance. There are many factors for why that has occurred.
Ron, how does this relate to John Q. Public?
John, the public is going to be adversely affected. In fact, the process has already started. As physicians in our specialties, specifically for myself, obstetrics and gynecology, start dropping out of obstetrics, which is considered a high-risk specialty by the insurance industry. What causes all this is, in the event of a lawsuit with a newborn infant, the settlements or the awards are generally so high that they force the premiums up for people who are practitioners of obstetrics. As obstetricians can no longer find or afford professional liability insurance, which is known as malpractice insurance, they stop delivering babies. They simply do gynecology. And as the pool of individuals delivering babies starts diminishing, and mind you, in the year starting January of '02, ending January of '03, in the last year, New Jersey has lost 13% of its 1,200 OBGYNs who have simply stopped delivering babies. And the public is affected in that their choices become limited. There was actually one county in New Jersey 6 months ago that was in danger of having no obstetricians. So for the first time in over 125 years, there was going to be an entire county in the state of New Jersey where there were no practicing obstetricians. So the public in that county would have had to leave their towns, leave their county, and go deliver a baby elsewhere. So that's the start of this crisis. But as it escalates, as physicians find fewer and fewer options to purchase insurance, which, by the way, they require to practice medicine in the state, the public will be adversely affected in that they'll have fewer choices of doctors. There'll be fewer doctors practicing obstetrics or high-risk specialties such as neurosurgery, trauma surgery, and the public may find themselves going to physicians out of their communities, to physicians they don't know or may not like, simply because they are the only ones available. That's the crisis that's ensuing now. It's taking place at this very moment. I can tell you the data I just gave you about 13% of the obstetricians leaving the state, that's already 6 months old.
Well, I think, and as we talked earlier before we went on camera, that the public is totally unaware of the tremendous, first, the expenses that doctors have between staffs, running their offices, so on and so forth, plus this insurance. And as you say, it's been escalating. And it seems to me that the public has this weird myth running around in their heads that, why should I worry about this? They make tons of money.
We've heard this many times
And I'm
before.
sure you have heard this many times. And yet I have looked at all the receipts and the things that I get back from the insurance companies and Medicare. And I wonder if most of your patients are about as well healed with insurance as I am. It's a wonder you can open your office in the morning, literally, because I am absolutely flabbergasted by how much they don't pay. So you take this and then add to this these exorbitant rates that you have to pay. It's no wonder that, it's easier either to give up doing that specialty, which is such a shame, because I know, Ed, you've saved so many lives, and it must be glorious to bring new
delivering
children
babies.
Into this world.
It's wonderful work.
It's just beautiful. So this would be eliminated.
When you spoke earlier about, is this a crisis, what defines it? Let's take a step back. Let's look at the everyday workings of an office. We have expenses we must pay to open up our door to see patients. The expenses include not only overhead and things like that, but the malpractice. But to balance that equation is also income coming in. And as you know, there are issues with Medicare as well as with other insurance companies. We are in a situation right now where the reimbursements that we get are not keeping up with the expenses that we have to put out in order to run our practices. And as malpractice goes up precipitously, that means that's a part of the formula that you don't have an immediate ability to balance. So it makes it difficult for us to continue. It's going to reshape many things. For the first time in 10 years, the amount of neurosurgeons that are part of the senior organization has dropped below 3,000 neurosurgeons for the entire United States. For 10 years, the number of applicants to medical schools decreased. People looking ahead and saying they don't want to be part of this, even though they wish to help people. So we see also employers, as healthcare costs rise, including malpractice being passed on as part of the expense, that they're deciding that perhaps maybe the employee should pay a greater portion of the deductible. Maybe they'll only cover 80% of the overall employee expense. And recent information is coming out even in Pennsylvania that some small businesses are not even providing insurance for people who work for them. That directly affects John Q. Public. In addition to that, if they don't have insurance, that increases the pool of uninsured that use emergency rooms and other places such as hospitals for care. So it's a crisis that is defined by many things that affects everyone, and it is clearly upon us right now, and will stay with us for the years, as you aptly noted in the beginning.
Ron, is this just a problem with neurosurgeons and obstetricians, or does this go to anesthesiologists and orthopedics? And is it graduated, these fees?
It affects the entire medical profession. We can divide medicine into the high-risk specialties and into the low-risk specialties. The high-risk specialties would be neurosurgery, obstetrics, radiology is considered a high-risk specialty. Any of the surgical fields, orthopedics, trauma, transplant, vascular, heart, I could go on and on. As opposed to the low-risk specialties, which would be family practice, internal medicine, psychiatry, dermatology, things of that nature. And the high-risk specialties are called high-risk specialties because the patients tend to be the sickest or can have the most go wrong. So I think that the crisis really is pandemic in that everyone in the profession is affected by this. As an example, if an internist doesn't have orthopedists to refer patients to, his patients are adversely affected. Likewise, if he doesn't have an invasive cardiologist or a radiologist who does mammography, his patients are affected. So everything in medicine affects everything else. Really, the entire profession is affected by this to a large extent. The high-risk specialties more than the low-risk specialties. But we're all really affected by this, and if we're affected, naturally our patients are affected.
So it's really the domino theory.
Absolutely. Very pure and simple. Everything is interrelated. And we talked about, you talked about the myth that the public has earlier. There was a time when physicians made a lot more money than they make today. I can tell you that in the past 7 years, I myself have seen my income drop by 40%. The problem is that as HMOs came into being, they started limiting the amount one could charge for one's services. And although other professions, such as the legal profession, which requires 4 years of college, 3 years of law school, they charge a certain amount based on their expertise and their wisdom and learning. The medical profession went in the exact opposite direction. It seemed to not matter how much experience a physician had or the degree of difficulty of the operation. There's one spinal surgeon in Manhattan who's often been quoted as saying that he does an 8-hour operation. If all 15 steps of this operation go exactly correct, he will get $1,500 and not get a $15 million lawsuit. I think Dr. Vanderschmidt actually knows the individual I'm speaking about. So the physicians, with all their expertise, with everything else, have seen their income erode, yet their expenses continue to rise. Now, I know this concept where the income is significantly less than the expenses can't operate very long. It didn't work for Enron. It's certainly not going to work for the average small business.
Well, we all know what happened with that.
So you're seeing a shift in the way physicians do business. They're no longer making the income that the public perceives them to make. The average person on the street thinks a physician should earn about $60,000. The truth is, most physicians earn more than that, but their expenses are such that the amount of comfort they have between their expenses and their income is so small now, there's very little leeway. There are some physicians who've actually had to take an equity loan on their home to pay for their malpractice insurance. These are unheard of situations in the medical profession, and they simply, as Dr. Vanderschmidt said, steer people away from our profession in our state. 3 months ago, when Robert Wood Johnson Medical School had their career night, you could have heard a pin drop at the OB/GYN career table. For the first time in 100 years, University of Pennsylvania's medical school graduated zero future OB/GYNs. Now, I worry about who's going to take care of my children. If this is a trend in medicine, if people are steering away from the profession, not necessarily because of the reduction in income, but the stress associated with liabilities and lawsuits and the potential loss of personal assets. Some of these lawsuits settle in multi-million dollars, and if you have a policy that covers you for $1 million and the lawsuit is for $5 million, you could be personally liable for $4 million, which means you're facing bankruptcy.
I read someplace, and I don't know where, that obstetricians, it's even tougher, their insurance, because a child has, until they are parents of a child that has, say, had a problem at birth, and the doctor is being sued, that can go up to, what, 21 years?
21 years under current law. There
That's
are currently
unreal, because you would have to retire or decide to retire 20 years before you ever wanted to retire.
And that's a trend that's emerging now. We're finding that young obstetricians, seasoned obstetricians at the peak of their craft, are basing their retirement age from obstetrics on the statute of limitations. So most of us retire between 60 and 65. So we are going to deliver our last baby based on what the statute of limitations is. Now, the current bills in front of the legislature call for a statute of limitation reduction from 21 years down to 13 years. So I can tell you, I'm going to deliver my last baby 13 years from whatever age I plan to retire. And my patients will lose a very seasoned, experienced obstetrician just because of the laws as they exist today.
Well, and what is being done to solve this? I know our time is fleeting, and the conversation has been so interesting, but what is being done to solve this? Where is it now? Where is it at this point?
Let me address it on 2 points. One is from the doctor's standpoint on how to solve it, and number 2 is what is out there in terms of legislative support or lack of support. From a neurosurgeon standpoint, again, what affects patients is the fact that the neurosurgeons are cutting back their emergency call or even covering hospitals. For instance, even hospitals in this area, as of this date, a hospital in my town does not even have full neurosurgical coverage. That means that the people may come in there and or not even come in there and be rerouted to another hospital in order to have adequate coverage. We can limit, to a certain extent, our liability expenses by the type of operations we do as well as how many places we go to. They look at the number of hospitals you're on staff with, the number of emergency rooms you cover. So physicians are limiting some of their practices so that they can limit the amount of malpractice bill that they have. That greatly affects patients. In Warren County, there is at this time, as far as I'm aware of, no neurosurgeons. And the neurosurgeon who left this area, I recently spoke with at a national convention. He's moved to another state, and his malpractice from what it would have been, which would have been well over 100,000, maybe around 130, is now 40,000 a year in the other state. So it's dropped over 100,000, or 75%. So that's what he has to do or she has to do in order to cover it. In addition, you're seeing other groups no longer being able to get people into the state. So they're limiting, maybe expanding their practice or getting a partner. They're limiting the type of people that they see. Some are even getting out of some insurance plans, even Medicare at this point, to try to limit the risk on somebody who's older and may have a greater risk of a complication. From a legislative standpoint, I think that the Senate has well heard the comments that we've made today and in the past, and they have listened to a majority of the physicians in compromising what we feel is an appropriate bill. It was the Senate 50 bill, which is now the Assembly bill after several revisions. And the Senate bill addresses not just short-term, but long-term issues in terms of caps. It's interesting that they can cap what we get paid for saving a life, but they're unwilling to cap what the pain and suffering for either their client or even for themselves. And the legislative bill that's out there right now being proposed by the Assembly only addresses the short-term issues by simply raising a pool of money that's available for high-risk people. It ends up working for some of the high-risk people in a short-term effect, does nothing for the medical profession or the liability crisis long-term, and certainly doesn't affect all of the physicians and help all of the physicians at this time when all physicians need relief.
All right, this is a question too, and it's personal, and hopefully that you won't take offense at it, but I would be remiss if I really didn't ask it. And do doctors really, I'm trying to think of the right word for it, watch each other? In other words, did this insurance go up because people have found it easier to sue, or because there are more errors? Or is it a combination of both, do you think? And do you kind of watch each other too? You know what I'm saying, govern each other to a degree. That if you find that there are those within your profession who really are making this whole thing at risk, and a lot of risk, do you kind of police that yourselves?
The answer is we do. One of the hats I wear also is chair of obstetrics and gynecology quality assurance, performance improvement. In other words, we review every single case that takes place in the department, and if we have any issues with regards to the care, we actually call that physician in, has to explain his actions, and then there's a ruling that takes place. We're constantly looking for ways to fine-tune our operations. And this is a process that's been going on certainly in the 20 years I'm in medicine, and way beyond that. These are procedures that have been in place for the better part of a century. The question is, how does one prevent an untoward event? There's what one calls negligence, and then there's something one calls a maloccurrence. I know in the obstetrical world, things can go terribly wrong in moments, things that are unpredictable, things that are outside of the reach of the obstetrician or anyone else to correct or deal with in such a way that there is no injury. But regardless, our society has no mechanism by which to compensate someone who's been ill or been injured other than to sue the practitioner. There's no mechanism in society. If a child comes out with a paralyzed arm, let's say, all of a sudden a woman, in my world for instance, a woman could be in labor and the baby's head may come out and the shoulders may be stuck. And this is an unexpected event. And it is a rare occurrence, but once in a while when a baby's shoulders are stuck, the arm comes out limp. This is known as an Erb's palsy. Most of the cases resolve within a year. In other words, the arm regains its strength. But some do not. And although this is unavoidable by the obstetrician, there's a lawsuit because that child has been injured, it will have medical expenses, et cetera, et cetera. So this is a maloccurrence, but it's lumped together
With negligence.
with negligence. And the obstetrician must be to blame, because if you listen to attorneys discuss this in court when there's a trial situation, they'll say, but you could have done a C-section, or you could have done this, or you could have done that, but the truth is you have only moments in which this is taking place. And if there's no indication of a way to avoid it, you're stuck. So our society has no mechanism other than for an adversarial situation where a patient has no recourse other than to sue a physician. Where do you go from there?
Do you want to add to that, Ed? I can see you working yourself up here.
Well, I think what we want to get across the idea is that there is not perfection in anything that is done. We do the best we can, and that with skill and with education, with credentials, you try to provide the best care. Mal-occurrence does not equal malpractice. And I think it's a perception in the public that needs to be further clarified. People need to understand that you can do everything you can, and despite all of those efforts, that a bad occurrence or bad outcome can occur, and that this itself is not defining malpractice by any means. I think we need to understand that all of this affects everyone. There are bills out there. There are states like California where they've had MICRA, which is a really a cost reduction act with regards to liability. But over the past number of years, over 10 years, while in states that they've not had caps, and again, we get capped for our expenses in saving a life, but not for the other, that one has to understand that MICRA has had a 100% increase in 10 years, which sounds a lot, until we look at the states where there is not a cap, and in a similar fashion, the malpractice went up 500%. So nothing in life has gotten cheaper as time goes on. We expect malpractice and premiums and other things to go up, but not in the manner in which they have. And people are now putting out information to saying that things such as caps will not go ahead and reduce insurance premiums. Nothing reduces insurance premiums from what they are today, but it caps and levels them and helps it make a better result for over the long term. And that's what's being missed right now. Information is being put out that it will not lower the premiums. It's not intended to lower the premiums from what they are today. It's attempted to help level the playing field and avoid a long-term crisis situation.
Well, this is not just a problem in Jersey, though.
This is nationwide.
This is nationwide. I know I have a dear friend in Florida, and she was just telling me that they went on strike down in Florida not long ago. And I said, well, you're coming back in May. They may go back out in May again, so stay in Florida for a while. You know, our time is running low, and I'm getting all kinds of signals over there from Cindy, and I had dozens more questions I want to ask. But what I'd like to wrap real fast is if information is needed, all right, they can, and would you like to give your website?
I'd also ask many people ask us, what can we do to keep our access to health care available, to keep physicians in the state?
And that's important.
And there is a statewide number you can call toll-free, 877-KEEP-MDs. That's K-E-E-P, M as in Mary, D as in David, S as in Sam. KEEP-MDs, 877-KEEP-MDs. You can tie in directly to your assembly people and tell them to do everything they can to solve this crisis. And then we have a website you can access, nj4healthcare.org. Anyone wishing information about this issue and how it's going to affect the profession can access this website.
And also they can call your office, which is, let me see, it's 1-609-924-6234.
You can call that number. I don't know if they answer it, but we'll call 924-3614.
3614. You see, I haven't called in a while. What can I tell you? I knew I'd go somewhere along the line. We must go. Thank you, gentlemen, for being here. My thanks to Dr. Magaziner for helping me with this. I'll see you all next month. In the meantime, take care.